Have you ever wondered why your legs keep feeling cold, numb, or tired, even when you have not done any heavy work? Have you noticed that even when the weather is warm, your hands and feet still often feel cold and numb? Or that small wounds on your legs take forever to heal? If the answer is yes, then you may be facing a silent yet extremely dangerous health issue: poor blood circulation. No one may have told you this, but a decline in blood flow, especially to the legs and feet, is not just uncomfortable. It can be an early sign of serious complications like heart failure, tissue damage, and even the risk of limb loss if not detected early. It sounds alarming, doesn't it? But do not worry, because in today's video, I will walk you through the full picture of this condition. Why does blood circulation decline? What warning signs should you pay attention to? And most importantly, we will explore one powerful vitamin that can improve blood flow to your limbs better than any therapy you may have heard of. A recent study from Harvard School of Public Health showed that this vitamin not only boosts circulation, but also reduces the risk of artery blockage and protects the heart comprehensively. I understand how helpless it feels when your hands and feet are always cold, when numbness keeps you awake at night, or when every step becomes heavy and unstable. And I also understand that once we pass the age of 50, our health begins to shift in ways that can leave us feeling worried and confused. But here is the good news. This condition is not your fate. You do not have to live with it forever. There are nutrients, habits, and small changes you can start today to reverse poor circulation. And the best part is, they are not hard to do. I will guide you through each cause in a simple way, share the often overlooked symptoms, and introduce 7 nutrients and habits that have been scientifically proven to improve blood flow, boost energy in your legs, and reduce persistent cold and numb sensations. Stay until the end because the final piece of information will surprise you. Number 7 might truly shock you with how effective it is, especially for those who suffer from cold, stiff legs every day. So, are you ready to discover the solution to bring warmth, mobility, and stability back to your legs? Keep watching, because the answer might change how you feel in your body every single day. 1. Vitamin B3, niacin, the guide for blood flow. Vitamin B3, also known as niacin, may not be a familiar name for many older adults. However, it is one of the most powerful nutrients for improving blood circulation, especially in the legs and feet. So, what makes niacin so special? First of all, niacin has a very important effect. It helps widen the blood vessels. This process is called vasodilation. It increases the flow of blood, allowing more oxygen and nutrients to reach your muscles and tissues, particularly in areas far from the heart, such as the feet. For older adults, where blood flow tends to slow down, this becomes especially important. According to a study published in the American Journal of Clinical Nutrition, niacin has been proven to reduce bad LDL cholesterol while increasing good HDL cholesterol. This is a key factor in keeping blood vessels clean and open. When bad cholesterol is reduced, there is less plaque buildup in the arteries, making it easier for blood to flow to your legs and hands. The recommended daily intake of niacin for older adults is typically between 14 to 16 milligrams. In some cases, doctors may prescribe higher doses to help treat cholesterol issues. However, high doses must be supervised by a medical professional because some people may experience a side effect called niacin flush, which causes temporary redness and a warm feeling on the face. You can add niacin to your diet through natural foods such as chicken, salmon, tuna, liver, and whole grains. Seeds like sunflower seeds are also a good source. For those who follow a vegetarian diet, beans and nuts are excellent options. A few tips when using niacin supplements. Avoid taking high doses without a doctor's approval, and it is better to take it after meals to reduce the chance of flushing. If you have liver disease or stomach ulcers, use niacin with extra caution. Niacin is a nutrient that not only supports blood circulation, but also protects heart health and nourishes your muscles and nerves. When blood flows properly, your feet are no longer cold or numb, and every step becomes lighter and more stable each day. 2. Curcumin, the golden compound that fights inflammation and opens blood vessels. Curcumin is the main active compound found in turmeric. It is considered a natural miracle for reducing inflammation and improving the function of blood vessels. This is especially helpful for older adults who are struggling with poor circulation in their legs and feet. It is no coincidence that traditional medicine systems from India to Asia have used turmeric for centuries to support blood flow and relieve pain and swelling. Modern science has confirmed these traditional practices. According to a study published in the Journal of Clinical Investigation, curcumin helps calm inflammation in the endothelium, which is the thin lining inside blood vessels. When the endothelium is healthy, blood vessels become more flexible and can expand more easily. This allows blood to flow smoothly to the lower limbs. That is why curcumin is especially helpful for people with peripheral artery disease, diabetes, and high blood pressure. But curcumin does more than just open up blood vessels. It also helps prevent the formation of blood clots by improving the elasticity and responsiveness of the blood vessel walls. This is very important for older adults, since blood clots are a common cause of strokes or blocked arteries in the legs. The recommended dose to achieve these effects is usually 500 to 1,000 milligrams of curcumin per day in supplement form. However, curcumin from turmeric is naturally hard to absorb. That is why it should be combined with black pepper, which contains a compound called piperine. Piperine can increase the absorption of curcumin by up to 2,000%. You can use fresh turmeric in cooking. Mix it with warm water and a pinch of black pepper in the morning, or take curcumin supplements that already include piperine for best results. However, if you are taking blood-thinning medication, be sure to speak with your doctor first, because curcumin also has a natural blood-thinning effect. With its ability to reduce inflammation, prevent artery blockages, and improve the flexibility of your circulatory system, curcumin is truly an essential nutrient. It helps ease leg pain, reduce swelling in the ankles, and improve endurance with each step you take. 3. Beetroot, the natural power of nitric oxide. Beetroot, also known as red beet, is not only a colorful root vegetable, but also one of the most powerful natural foods for improving blood circulation, especially to the legs and feet. These are areas that are often affected by poor circulation in older adults. What makes beetroot special is its high content of natural nitrates. Once inside the body, these nitrates are converted into nitric oxide, a vital molecule that helps blood vessels relax and widen. This expansion of the blood vessels allows oxygen and nutrients to flow more freely to the muscles in your legs. As a result, it helps relieve tiredness, reduce soreness, and improve stamina during movement. According to research from the University of Exeter in the United Kingdom, older adults who drank beetroot juice for just 2 weeks showed significant improvement in their walking ability and felt less heaviness in their legs. Nitric oxide from beetroot also helps lower blood pressure, supports heart health, and benefits those with peripheral artery disease. In addition to supporting circulation, beetroot is rich in antioxidants like betalains and vitamin C. These nutrients protect blood vessels from damage caused by free radicals, harmful substances that lead to chronic inflammation and vascular degeneration. You can add beetroot to your diet in many ways. You can drink it as juice in the morning, cook it in soups, steam it, or slice it thin and add it to salads. A daily serving of about 250 to 300 milliliters of beetroot juice is ideal to gain the benefits without putting strain on your kidneys. One thing to keep in mind is that beetroot may turn your urine or stool a reddish color. This is completely normal and not harmful. However, if you have a history of kidney stones caused by oxalates, it is best to avoid raw beetroot and consult your doctor. Beetroot is not just a nutritious food. It is a quiet helper that reduces leg numbness, boosts walking strength, and makes your legs feel warmer and more flexible day by day. 4. Garlic, the traditional spice that protects your blood vessels and prevents clotting. Garlic is not only a familiar ingredient in the kitchen, but also a natural remedy that has been used for thousands of years to support heart health and improve blood flow. For older adults, especially those who often feel numbness in their limbs, swelling in their feet, or suffer from varicose veins, garlic offers a simple but very effective solution. Garlic contains an important sulfur compound called allicin. Allicin is released when garlic is crushed or chopped. It is the key substance that helps relax blood vessels, soften the vessel walls, and allow blood to flow more easily. Because of its ability to reduce blood pressure and improve the flexibility of arteries, garlic helps reduce stress on the heart and supports better blood circulation to the limbs, especially the legs. According to a report from the American Journal of Clinical Nutrition, regular consumption of garlic can lower bad LDL cholesterol and also inhibit the formation of blood clots in the blood vessels. This is very important for older adults because small blood clots that build up in the leg veins are a major cause of leg heaviness, pain after standing for a long time, or even the risk of pulmonary embolism. Garlic also helps reduce mild inflammation in the blood vessel walls, which is a leading cause of damage to the inner lining of arteries. When chronic inflammation is under control, the circulatory system runs more smoothly, and the oxygen delivery to leg muscles improves noticeably. The best way to use garlic is to eat it raw, but that is not always easy, especially for older adults with sensitive stomachs. You can finely chop 1 to 2 cloves of garlic, let it sit for 10 minutes to activate the allicin, and then swallow it with warm water in the morning. Garlic can also be added to stews, soups, or broths to enhance flavor and support your health. If you cannot tolerate raw garlic, aged garlic extract supplements are a good alternative. These supplements do not have the strong odor and have been clinically studied to show strong effects in supporting blood flow. However, if you are taking blood thinners or aspirin, be sure to consult your doctor before using high doses of garlic or garlic supplements to avoid the risk of bleeding. Garlic may be small, but it is a silent warrior that improves circulation, protects your blood vessels, and brings a lighter, more flexible feeling to your legs every day. A small change in your daily meals can bring lasting benefits for your leg health and your heart. 5. Arginine, the amino acid that promotes vessel relaxation and delivers oxygen to leg muscles. Arginine, also known as L-arginine, is a semi-essential amino acid that plays a very important role in producing nitric oxide, the compound responsible for relaxing and expanding blood vessels. This process improves circulation to the limbs, especially the legs and feet. For older adults experiencing numbness, nighttime cramps, or difficulty moving due to poor blood flow, arginine is a nutrient worth paying close attention to. The way arginine works is clear. When it enters the body, it is converted into nitric oxide, which helps blood vessels relax and widen. As a result, blood flow increases, and more oxygen and nutrients reach the leg muscles. This helps relieve the heavy feeling in the legs, supports muscle recovery after activity, and prevents nighttime leg cramps. A study from McMaster University in Canada showed that supplementing with L-arginine improved walking ability in patients with peripheral artery disease. This improvement comes from the increased blood flow to the leg muscles. In simple terms, older adults who take arginine may be able to walk longer distances, feel less tired, and experience fewer cramps during movement. Arginine is naturally found in many high-protein foods such as chicken, fish, lean red meat, eggs, yogurt, soybeans, peanuts, and almonds. For vegetarians, lentils, pumpkin seeds, and oats are also excellent sources. The recommended dosage from supplements is usually between 2 to 6 grams per day, divided into 2 doses. However, for those with liver, kidney, or blood pressure issues, it is important to consult a healthcare provider when taking high doses. Some people may experience mild side effects such as nausea, diarrhea, or bloating when they first start using arginine. You can take L-arginine supplements in 500 milligram or 1,000 milligram tablets, usually in the morning and before bedtime to support nighttime circulation. Some people combine L-arginine with L-citrulline, another amino acid that helps extend nitric oxide production in the body, for a more sustained effect. What makes arginine truly special is its ability to relieve the tight feeling in your muscles after movement, while gently expanding the leg blood vessels to improve flow throughout the lower body. If you often feel that your legs are cold, easily tired after walking, or numb after sitting for a long time, your body might be lacking arginine. Adding arginine to your routine not only helps your legs feel lighter, but also boosts your overall sense of strength and flexibility in daily life, especially if you want to stay independent and keep moving freely as you age. Take a moment to think about your legs. They have carried you through so many stages of life, from your very first steps to long hours standing, from joyful walks to those times when you had to climb the stairs even as your body grew older. And now, if you are starting to notice that your legs feel colder, weaker, or more frequently numb, that does not mean you have to accept this as a permanent part of aging. You have just discovered a series of simple yet powerful nutrients and habits that can improve poor blood circulation in your legs and feet. From niacin, curcumin, beetroot, and garlic to arginine and other helpful factors, each of these plays a special role in supporting blood flow, reducing inflammation, preventing blood clots, and protecting your blood vessels. There is no miracle solution that works overnight, but small steps, every meal, every glass of juice, every gentle movement, can slowly bring about real and lasting change. The important thing is to begin somewhere. You do not need to change everything all at once. Start with one food or one habit that feels easiest for you. Maybe it is adding a little garlic to your meals, trying a glass of beet juice in the morning, or simply raising your legs for 10 minutes before bed. Remember, taking care of your legs is not just about mobility. It is about maintaining your independence and dignity. When your legs are strong, you walk with confidence, move with ease, and live without the constant worry of cramps, aches, or imbalance. If you found today's message helpful, do not forget to click the like button and subscribe to the channel so you do not miss the next videos on senior health and daily wellness. Are you currently using any of the vitamins we talked about today? Please share in the comment section below. I would love to hear your story and walk alongside you on your journey to restore strength and comfort in your legs. Wishing you health, peace, and good circulation always. See you again in the next video.